My name is Mia Lin. I'm a nurse practitioner with Maternal and Family Health Services, and today I'm going to talk to you about birth control options. There are many birth control options that are available, and knowing your birth control options is important to ensure that you're getting the one that works most for you. The first birth control option that most people are familiar with is birth control pills. There are two types of pills. So there's combined pill and there's progesterone-only pills. Combined pills have estrogen and progesterone. We determine which pill might be a good option for you based on things like your health history, your family health history, if you're a smoker over the age of 35, among other things. So with birth control pills, estrogen in combined contraceptive helps to keep that lining of the uterus nice and thin and can help to prevent ovulation. Progesterone-only method just prevents ovulation. Most of the time, we give combined birth control pills, but if you have health issues like high blood pressure or you're a smoker over the age of 35, we will give progesterone-only pills. It's important to remember that not all pills are the same, and one pill may not work for you, but another pill may. It's all trial and error. There are other combined birth control options like the vaginal ring. The vaginal ring is a silicone ring that you insert into the vagina for 3 weeks, then you remove it for a week to have your period, and then you would place a new vaginal ring. It's soft and squishy and flexible. You should not be able to feel this when it's inside. The patches are exactly that, a patch that you put on your body. You put a new patch on once a week for 3 weeks, leave the patch off for a week to have your period, and then start the process over. For anyone using a combined birth control method, like pills or the ring or the patch, there's an increase for heart attack, blood clots, and stroke. Your risk for those things is decreased if you have no medical history, such as high blood pressure, migraines with aura, blood clots, or smoking over the age of 35. The next progesterone-only option is the Depo. It's a progesterone-only method that you get a shot once every 3 months. This option prevents you from ovulating, and your bleeding may vary. Some people, most people, don't get a period at all. However, some people will have irregular bleeding or spotting or constant bleeding. If daily bleeding occurs, I usually recommend choosing an alternative option. The only thing about Depo is that after you stop it, if you're looking to conceive, it can take up to a year for your fertility and period to resume. Another option is the Nexplanon. This is a 4-centimeter rod that we insert into your non-dominant arm. But this is something that we put in the office. You are numb for the procedure, and this option is good for 3 years. With the Nexplanon, you might have irregular bleeding or spotting, you might have daily bleeding, or you may have no period at all. The great thing about the Nexplanon is once it's removed, your fertility resumes within just a couple days. It's a great option for somebody who's looking to avoid taking something daily, weekly, or even every few months. Next, we have IUDs. These are the T-shaped devices that are inserted into the uterus. We have 2 options for IUDs here at MFHS. Mirena IUD, not pictured here, is a progesterone-only IUD, and it is good for 8 years. The Mirena IUD works by keeping the lining of the uterus nice and thin, so if an egg did get fertilized, it can't implant in the uterus. It also increases your cervical mucus to try to prevent sperm from getting into the uterus to begin with. With the Mirena, the first 3 to 6 months, you're going to have irregular bleeding and spotting. Generally, after 6 months, most women have either no period at all or a very light period. The other popular IUD option is the Paragard, a copper IUD. The copper IUD is the only non-hormonal birth control method, and it is good for 12 years. It works by killing the sperm before it can do anything to fertilize an egg, and also increases your cervical mucus to prevent sperm from getting in the uterus to begin with. The important thing to know about the Paragard is it can make your period last a day or 2 longer, give a little more cramping with your period, and make your period a little heavier. This is a great option for someone who doesn't want hormones but wants protection against pregnancy. There are other options, such as surgical options for men and women. For women, it's a tubal ligation, and for men, it's a vasectomy. A tubal ligation is a same-day procedure where they go in, cut the fallopian tubes, and actually remove them. There's no more tying or burning these days. Removing the fallopian tubes prevents an egg from getting into the uterus to be fertilized by the sperm. A vasectomy is a procedure that's done in office for men, where they cut the vas deferens, the tube that transports the sperm to the urethra opening, and that is cut and sealed. Men will still ejaculate, but there will be no sperm in it to fertilize an egg. The last few birth control options that we have are condoms, such as the male condom and female condoms. And we always have them in stock. There are other options like spermicide, vaginal gel, which changes the pH of the vagina to try to kill sperm before they can fertilize an egg, natural family planning, and withdrawal method. These options are the least effective and have higher rates of pregnancy. No matter what birth control option you choose, MFHS is here to help you through that journey. From educating to implementing, MFHS is here for you.